Okay, Ben. So your temperature was 98.3 orally. Your heart rate was 75, regular rate and rhythm. Your oxygen saturation was 99% on room air, and now I just need to check your blood pressure. How tall are you?
11.
And what's your weight? 185. And your blood pressure is 108/70. Now I'm just going to look over your skin. And what I'm checking for is any lesions, rashes, moles, anything that looks concerning. And everything looks okay back here. I don't see anything abnormal. No irregular borders or colors. And then just looking through your hair, which is clean and well groomed. And then I'm looking at your fingernails that are also well groomed and clean. Now I'm just going to palpate your skull. Face. No step-offs. I'm going to have you open and close your jaw. Any tenderness? So no tenderness to your TMJ joint. And now I am just going to look at your eyes and your eyelashes and your eyebrows. I will have you look up. And the sclera is white. The conjunctiva is pink and moist. And your pupils are 4 millimeters and 4 millimeters. I'm going to have you look at my nose right now, and I just want you to follow the pen with your eyes. Good external ocular movements. I am going to check for corneal reflex. And I see light in both eyes. I'm now going to check for constriction and a compensatory response in the other eye. So, left eye constriction and compensation in the right. Right eye constriction and compensation in the left. Now I am going to have you stand, and there is a Snellen eye chart on the wall. I want you to cover one eye at a time. First cover the right and read the smallest printed line that you can read.
DEFPOGEC.
Okay, and to the other eye.
DEFPOGEC.
Okay, so you have 20 vision. I'll have you sit. And now I'm going to take my otoscope and I'm going to do a fundoscopic exam. So with my left hand and my left eye, I am visualizing the optic disc, which is yellow, and a positive red sign. I see arteries and veins and the macula. Holding with my right hand and my right eye, I am visualizing the left optic lens, optic disc, the macula, arteries and veins, and the red sign. Okay. Now I am going to look at your nose. Actually, I'm going to look at your ears. Any tenderness?
Nope.
Touching the pinna, the tragus, the mastoid process, any pain, tenderness? Okay. And I'm gonna stand behind you and I'm gonna whisper 3 words, 3 letters, and I want you to repeat whatever I say.
1, 2, 3.
Correct. I'm gonna take my otoscope and I'm going to look inside the ear. Outside, I don't see any drainage, no growths, no abnormalities. I'm gonna pull the pinna up and back, and I am visualizing the tympanic membrane. It is pearly gray and intact. No foreign bodies. And I will look at the right. I see no drainage, no obvious abnormalities or growths. I will pull back on the pinna, and I am visualizing the tympanic membrane, pearly gray and intact. And now I am going to have you occlude one nostril and do the same thing to the other. Both patent. I'll have you tip your head back. And I'm just looking in the nares. Maybe a slight deviation to the left nostril. No exudate, no blood, no nodules. Okay, I'm going to have you open your mouth. Stick your tongue out and say ah. I can visualize the tonsils. There is pink, moist mucous membranes, no blood, no swelling. And now I'm going to have you touch your chin to your chest and move your neck side to side. Any tenderness or pain there? Any pain when you swallow?
Nope.
I will stand behind you, and your trachea is midline, no deviation. Swallow. I do not feel any enlargement of the thyroid. And I'll have you just tip your neck back so I can look. And I don't see any obvious enlargement of the thyroid there either. Now I'm going to palpate your lymph nodes. Preauricular, postauricular, occipital, tonsillar, submandibular, submental, superficial cervical, deep cervical chain, posterior cervical, and supraclavicular. Any tenderness there?
No.
Okay. So now I am going to look at the chest. And I'm just going to watch, take a couple deep breaths. And I see equal chest rise and fall. Breathing is unlabored. And I will have you turn around for me. And I am just palpating for any tenderness, crepitus, or masses. Anything hurt when I'm touching?
Nope.
Anything hurt in the front?
Nope.
So now I'm going to percuss. And I hear resonance throughout. Dullness over the diaphragm. Did you feel any tenderness?
No.
No CVA tenderness. And then I would like you to take a deep breath every time you feel my stethoscope. Lung sounds are clear throughout. I'll have you turn around again. And I'm going to do the same to the front, just percussing. And listening. Deep breath in. Okay, and lung sounds are clear throughout. Okay. Now I'm just going to look at your neck with tangential lighting. I'm looking for any pulsations or obvious JVD, and looking at the chest. I'm going to feel for your apical pulse, which I feel. Regular rhythm and rate. I am going to feel for your carotid. And on the other side. And now I'm going to listen to the carotid on either side. Now I'm going to listen to your heart with the diaphragm and bell of my stethoscope. And I hear S1 and S2 in each position. I'm going to have you do this. I'm going to listen again with you leaning forward. And I hear S1 and S2 throughout in each position. I'm now going to feel for your pulses, brachial in the right and in the left. And make sure they're equal. And there. And now I will have you just relax your leg. Here, you can put this back on. Let's tie this for you. Just a little bit. And I will feel for your popliteal. And in the left. And I will feel for your dorsalis pedis and your posterior tibial. And again in the left, dorsalis pedis on the top of the foot and your posterior tibial. Okay. And they are equal, regular throughout. Now I'm going to have you lean back and I'm going to assess your abdomen. And again, with my tangential light, I'm looking for any pulsations, any veins, masses. I don't see any. And I am going to auscultate for abdominal sound starting in the right lower quadrant. Right upper quadrant. Left upper quadrant. And left lower quadrant. And I'm going to listen over the aorta. And I'm going to listen over the femoral. And feel for femoral pulses. Which are regular and even. And now I'm going to percuss. And I hear tympani throughout. I am now going to determine the borders of the liver by starting below the umbilicus. Tympani. And I hear dullness, so that will be my lower border. And now I will percuss from above the nipple line. And the upper border, which is about 7 centimeters, which is normal. I am now going to palpate with light palpation, just feeling for any tenderness, masses, crepitus, and slightly more palpation. Any tenderness?
Nope.
No. I'm now going to try and entrap the kidney. And the left. And the spleen. Now I'm going to have you tilt your head up and cough, feeling for hernia, and again. I'll have you sit up. Now I'm just going to look at your musculoskeletal systems, and I'm going to just feel for tone. And I'm going to check for strength by having you pull towards me, push away, all right, and push against my hands, push towards them, okay. Lift this leg up, push against me, and towards your head, okay, and against my hand, and towards your head, okay. And now I will check for your reflexes. Biceps, triceps, brachial artery, patellar, and Achilles, and on the other side, up here, biceps, underarm, triceps, brachial ulnar, brachial radialis, patellar, and Achilles. And then I'm just going to feel your joints. Any pain or tenderness?
Nope.
Any pain or tenderness?
No.
I'm also looking for redness, heat, swelling. Shrug up against me. And bend your knee here. And any tenderness there?
No.
Okay, so good strength, good tone. Your reflexes all seem to have good range of motion and no pain. I am now going to test for light sensation. I'll have you stand up. And I want you to close your eyes and tell me where you're feeling this cotton ball.
Yeah. Left side. Your hand. Like toes. Toes.
Okay, good. So now I'm gonna have you, while you're standing, close your eyes and put your hands out in front of you, and I'm gonna count to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good. Now I'm gonna have you walk heel to toe across the room. Good. And now just walk regular in a lap around the room. All right, and you have a strong, steady gait. I'll have you sit back down here. Any pain?
No.
Any tenderness anywhere?
No.
Lightheaded or dizzy? Okay, do you have any other questions for me?
No, I don't.
Okay, then the exam is over. I will get everything written up for you, and I will be back in just a few minutes.
Okay. Good choice. Thank you.
Take care.